I think one thing that is interesting about having had a personal weight loss journey myself is that when patients come into the room to meet with me, sometimes I can start to predict some of the preconceived notions they may have about either things that I'm thinking or things that they may be, imposing on themselves, judgments or thoughts they may be having. And I think that there's a lot of these kind of narratives that we have culturally of people that have extra weight are lazy, or people that have extra weight are, they eat too much, or they have no self-control. And we have, all of these narratives that I think sometimes individuals that have excess weight even begin to impose on themselves. And we know that in medicine, a lot of that bias, unfortunately, is perpetuated. And I think that for other physicians, I would encourage them to be completely open-minded and approach every patient with, a completely blank slate. Just yesterday, I had a patient that said, "You wouldn't believe how little I eat if you looked at me." And I said, "I would believe that." I said, "I have no expectation for what or how any of my patients eat, because I've seen the gamut. I've seen patients that have a lot of weight that they want to lose and they're barely fueling their bodies." And we talk about how their body is actually in a fat retention reflex because their body thinks they're starving. And if they're not properly fueling their body, it's going to actually hold on to body fat and prevent successful weight loss. And on the other hand, I have patients that really struggle with binge eating disorder, and with that, they're consuming more calories than they need for an entire week in one sitting. And so understanding that every single patient has a completely unique and individual set of factors that is contributing to their health is of utmost importance. So basically go in not with a blank mind, but a blank slate.